Hi, my name is Eileen Lorenzo, and today I'm going to be presenting my project in ultrasound. I hope you enjoy, and here's my video. So to begin my project, I'm going to start with what exactly is ultrasound and the general overall view of ultrasound. So ultrasound is imaging that uses sound waves to produce portraits, images of the inside of the body. This is used to detect the causes of possible pain, inflammation, and infections in the body, internal organs. This is often used due to examinations of a baby when a woman is pregnant or believes she is. You can see the development as the trimesters go on and the development of the baby, such as the heart rate, brain, and hips in infants. I actually got to see this last week. One of my family members, they are pregnant, and I got to see they have like a group ultrasound, and I got to see the 3D and like 3D ultrasound, and it's crazy. Like, it's like if you have the baby in front of you but still being in the womb. So ultrasound is one of the modalities that has really, with technology, has grown a lot, and it's another modality that you can see things that can be seen with the visible eye. You're able to see it, and it's really detailed. It just works with sound waves, compared to like X-ray or CT or anything like that. So here is an example of ultrasound, also known as sonograph. Fun fact, ultrasound is safe to use. It's non-invasive, so that means it doesn't require any equipment, any surgical equipment. It does not use ionizing radiation, which, what does ionizing mean again? It means particles or electromagnetic waves that carry significant energy that detaches electrons from atoms. This also affects the human body once it enters. Depending on the doctor, sometimes they require you, what I've heard, most people that do ultrasounds, they always require you to drink a lot of fluids. And I guess that helps you capture the better image that is required. So here I found this really awesome little 60-second video explaining what the ultrasound machine looks like and what exactly is inside that makes, like, the functions and the applications of the actual system itself, breaking it down. So I'm going to go ahead and play the little video, and you guys can see exactly what I mean.
The heart of most ultrasound systems is a device called a transducer, which uses an array of piezoelectric crystals. A piezoelectric crystal vibrates when an electric signal is applied, producing high-frequency sound pressure waves, which we call ultrasound. More importantly, this type of crystal can also work in reverse. It can produce electrical signals when it detects high-frequency sound pressure waves. When a transducer directs ultrasound waves into the body, they pass right through the skin and into the internal anatomy. As the waves encounter tissues with different characteristics and densities, they produce echoes that reflect back to the piezoelectric crystal. This happens more than 1,000 times a second. Returning echoes are converted to electric signals, which a computer converts into points of brightness on the image, corresponding to the anatomic position and the strength of the reflecting echoes. A medical transducer contains a large array of crystals which allow it to make a series of image lines that, together, form a complete image frame, called a sonogram. In addition, all the crystals are repeatedly activated many times in such a way that a complete image frame is formed around 20 times per second, so that real-time motion is displayed in the ultrasound image.
So here, I found this cool graph. Since ultrasound does work with sound waves, there's different type of frequencies. This is a little graph showing you an estimate of what body parts, how many hertz it uses. For example, 0.5 hertz for deep abdomen, gynecological imaging, or 3.5 for general abdomen. Breast is 5.0, thyroid 7.5, some beans are 10.0. It just depends. It all works different. It all requires a different amount. I found this cool. Like I mentioned before, since we know these are sound waves, how does it work? The video that I showed previously shows you how it works. There's going to be two videos I'm going to be showing you. The high frequency sound waves travel from a pulp through the gel into the body. The pulp accumulates the vibrations that bounce back, and a computer uses the sound waves Pylo's electrical effect. This effect converts kinetic or mechanical energy into electrical energy due to the diffraction of the crystal. This is how ultrasound transductor receives their sound. So what is anechoic? Anechoic is the tissues that do not grate onto the echo, such as fluid in the bladder that appears black on ultrasound imaging. Artifact products of ultrasound image, such as gas in the bowel or an acoustic shadow that does not represent an actual atomic structure, they appear black, which means there are no internal echoes. Some examples would be cysts, vessels, gallbladder, and water. Hyperecho is a related term that refers to echoes from returning from a structure. This tissue that generates a greater echo usually displays a lighter color during ultrasound imaging. This increases the density of the sound waves compared to the surrounding structures. Some examples would be bone or fat. Hypoecho refers to the structure that creates a weaker echo, such as fluid. The tissue with a lower echogenicity are usually representing a darker color on the ultrasound. This one gives off fewer echoes. They are darker than the surrounding structures. An example of these would be a lymph node or tumors. And the last one, isoecho, is a tissue or structure in which the produces an echo of the same length as that of a surrounding structure or tissue, making it difficult to isolate.
Doppler ultrasound is used to detect flow within vessels. To demonstrate the use of the Doppler ultrasound, we will obtain a mid-long axis view of the common carotid artery and use a high-frequency linear transductor. Activates the color of the dropper on the device and positions the color box over the lumen of the common carotid artery, or CCA. The color bar serves as a legend that maps the color of velocity and direction of the blood flow. Here, the red color indicates flow toward the transductor, and the blue color indicates the flow away from the transductor. The intensity or brightness of the color is the representation of the velocity of the flow. By convention and display, that should be configured so the flow within the arteries is represented as red and the flow within the veins is blue. The color bar can be integrated. This is generally done to display normal transactional flow in the artery, or to represent the red color, adjust to the color gain necessary so the color can only appear in the lumen and of the vessel, not the outside of them, and the normal CCA has a laminar flow pattern. This means that the flow velocity in the center of the vessel is higher than near the wall of the vessel. That activates the spectrum dropper display mode of the spectrum dropper waveform and enables the user graphically visuals of the velocity of the blood flow. Over time, the system is dependent among the user to set a number of parameters so that correct result is displayed. First, the Doppler sample volume gate should be positioned in the center of the lumen or the area of the highest velocity. Next, adjust the sample volume of the sample volume. It's the area of the flow that will be represented in the waveform. The sample volume size should be set approximately 1/3 of the vessel diameter. Another user comfortable parameter is an angle correct setting, or the AC. The AC corresponds with this bar. The purpose of this setting is to provide a correction factor in order to achieve the correct installation angle. The goal is to align the AC bar with the direction of the flow of the AC value should be in the range of 0 to 60 degrees. For the carotid artery, the Doppler study obtained a numeric value for the flow velocity by using the measurements tools, freeze the